Hello, my name is Dr. Michael Osner, and I am Medical Director of Wellness and Prevention at Baptist Health, South Florida. Cardiovascular disease and its clinical manifestations of heart attack and stroke is the #1 killer of men and women in the United States and around the world. As Symposium Director of Cardiovascular Disease Prevention 2011, we would like to invite you to attend our 9th annual comprehensive symposium dedicated to the treatment and prevention of cardiovascular disease. This meeting will be held February 3rd, 4th, and 5th, 2011 at the historic Biltmore Hotel in Coral Gables, Florida. Our esteemed, world-renowned faculty will discuss the latest approaches for the primary and secondary prevention of cardiovascular disorders. Those attending the meeting will have an opportunity to participate in the case management sessions with the faculty utilizing a state-of-the-art audience response system. This is a summary of Cardiovascular Disease Prevention 2011.
If the truth were known, heart disease is a toothless paper tiger that need never ever exist. And if it does exist, it need never ever progress. I think the most important fundamental thing that we're trying to introduce as a new form of therapy, a new dimension in cardiovascular disease treatment, is counseling of the patient. In other words, let the patients know what is the causation of their disease and show them what they can do to totally remove the causation of their disease, stop the disease, and have them recover. And it's very, very basic. And we have found that it has been very successful in the arrest and reversal of this disease. And I do look forward to this opportunity at this symposium to share this work with the registrants.
We have now the ability to run what are called genome-wide scans, looking at hundreds, if not thousands, of different genetic differences between patients to see whether or not we're at risk for heart attack or stroke. And what we published and presented here at these meetings is a provocative study of nearly 20,000 individuals followed for 10 years, where we ran those genetic studies. And the punchline was puzzling. Turned out that the genetic information actually added very little, if anything, to standard risk factors. So the expensive genetic screening was not so useful. Yet, family history, whether or not your mom or dad had a heart attack before age 60, was a very powerful predictor of risk. So one possibility is our genetic scans are not yet sophisticated enough to tell us the information we need. Another possibility is what we inherit from our parents is more than just their genes. It's a shared environment. It's eating together, perhaps smoking together, perhaps exercising or not exercising together, and that the shared environment we grow up with our siblings in is as important as the shared genes we have with them. So stay tuned. Much to be learned about the genetics of heart disease. As of right now, screening may not be as important as we once thought.
This topic will focus on the important role that stress plays in promoting heart disease and whether positive emotions, including laughter, might in effect improve the blood vessels.
We look forward to seeing you this February at Cardiovascular Disease Prevention 2011.